Welcome back to the CivDiv. Let's talk about feet. Let's get into it.
Whiskey 9 Yankee 7 November Golf, over.
Okay, so feet, as far as the 38 CFR is concerned, has a myriad of conditions that you can actually claim. But in this video, we're going to be talking about something very specific, and that is plantar fasciitis. So what is plantar fasciitis? Well, plantar fasciitis involves the inflammation of the plantar fascia, the tissue connecting your heel bone to your toe. So there's quite a few things that causes plantar fasciitis. Age being one of them, long distance running, poor footwear, obesity, standing for too long. All of these are right in line with our military service. So we are the prime candidates for a lot of the plantar fasciitis issues. So that is really the holistic causes and risk factors for plantar fasciitis. But among vets, it's really that long distance running, that PT, the wearing of boots with poor arch support, and a lot of the occupations that we hold that causes our feet to be affected in a way that then gives us plantar fasciitis. So as far as plantar fasciitis is concerned, what are really the symptoms? Well, a lot of it is going to be heel pain and that tenderness, especially after standing and running. Relief can often be found through icing, pain meds, supportive footwear, and in some severe cases, cortisone shots. But I will tell you, a lot of these cases end up being so severe that a lot of those don't really help. And there are some surgical reliefs that you can pursue for plantar fasciitis. Okay, so let's go ahead and look at diagnostic code 5285, which is the disability rating for plantar fasciitis. We're gonna start at the top, kind of the middle, and then get down to the bottom. We have 30% rating, which is given for no relief after treatment. So we're talking about those cortisone shots. We're talking about the foot implants, medicine, all of those things. After treatment, they're just nothing. And that's bilateral. We have 20% for unilateral cases, and we have 10% for less severe cases. Now, here's where we get kind of crazy with the ratings, and we have a 40%, which is notable actual loss of use of the foot. So you have so much pain that you literally cannot use your foot anymore, whether that be from flexibility, whether that be from actual pain of walking, standing, whatever the case may be, that will be hitting that 40%. So we all know from elementary school science class, the body's connected in all sorts of ways. So veterans with plantar fasciitis may be eligible for service connection or secondary connections that are linked to a myriad of different body parts, such as knees, hips, ankles, and other parts of the feet, and even the back in some cases. Obviously, this requires medical diagnosis and evidence of a primary disability and medical nexus. Still, if you can gather that evidence, your plantar fasciitis is affecting other connected parts of the body, you can get those secondary connections. I will give you this major tip though. One of the leading causes for plantar fasciitis is flat feet. So for all of you guys out there with flat feet, plantar fasciitis is a go-to, easy, service-connected secondary that you can pursue that has a direct correlation with flat feet. Flat feet causes that stretching of that fascia and definitely will cause foot pain, and it can be led strictly and directly to flat feet. So when you're walking around and you actually feel that pain, most of the time, if it's in the back side of the foot, that is plantar fasciitis and not just your flat feet. Also, another pro tip, for all of you wearing those insoles that are used to help flat feet, that can cause plantar fasciitis as well, because that extra pressure will then stretch out the fascia that is really tight due to you having flat feet altogether. So you might actually get foot pain later on if you wear those insoles excessively. So that's another thing to be aware of, so you can really figure out how you're going to pursue your plantar fasciitis claim. So who is going to diagnose your plantar fasciitis? Well, really, it depends, but what we often find is it's going to be the podiatrist, the same person who's going to be diagnosing your flat feet or any other foot condition. They will be able to help you understand what your feet are doing and what connections or conditions you have according to your symptoms. But you got to make sure that they articulate in a very detailed manner exactly what's going on in your feet, because plantar fasciitis often gets confused with flat feet, especially if you have fallen arches. So you got to be very, very careful with how they articulate exactly what's going on with your feet. So if you're not going the secondary route for plantar fasciitis and not wrapping it under something that's already going on or already service-connected disability, such as flat feet or any other foot condition, then make sure you have those three things that we've talked about: in-service evidence, your current diagnosis, and that nexus, linking everything together. Those are still going to be the three things that you're going to need in order to have service connection. So just be aware in collecting that evidence, or if you don't have evidence, make sure you're putting those statements out there and having a strong nexus, whether that be a nexus from the VA healthcare or outside medical entity doing a nexus letter, and having those DBQs in to really articulate what's going on with your feet. All right, so that is it for plantar fasciitis. I hope this kind of clears up a few things for you guys and gives you guys some ideas on how you can navigate your plantar fasciitis evidence collection, the secondary conditions that you can associate with it, or it being a secondary itself. As always, this is Jay with the CivDiv. Stay informed, stay resilient, and I will see you next time.